A set of exercises known as pelvic floor exercises is intended to strengthen the muscles in the pelvic floor. The pelvic floor is a collection of muscles that support the bladder, uterus, and colon by creating a hammock-like structure at the base of the pelvis. To increase the strength, endurance, and flexibility of the pelvic floor muscles, these exercises actively contract and relax them. Both men and women can benefit from pelvic floor exercises, although women need them more than men do, especially during and after pregnancy and after menopause. The following pelvic health concerns can be prevented or treated with pelvic floor exercises. 1. Urinary incontinence. Increasing pelvic floor muscle tone might lessen or stop unintentional urine leaking. 2. Pelvic organ prolapse. By supporting the pelvic organs and lowering the likelihood of prolapse, a stronger pelvic floor can aid. 3. Healthier muscle control can help with healthier bowel motions and lower the risk of fecal incontinence. 4. Sexual health. Pelvic floor muscles that are strong can improve sexual gratification and sensation. Pelvic floor exercises can be carried out easily and covertly without anyone noticing. The Kegel exercise is the most popular workout. 1. Recognize the muscles. Find the appropriate muscles before beginning a Kegel exercise. Think about contracting the muscles you would use to prevent passing gas or stopping the pee flow. 2. Contract the muscles. After determining which muscles are part of the pelvic floor, contract them for 5 to 10 seconds. While doing this, try to avoid holding your breath or tensing any other muscles. 3. Relax your muscles. After a muscle contraction, relax them and give your body a few seconds to recover. 4. Repeat. Begin with 10 reps, then as you get more familiar with the exercise, increasing the number of repetitions. Exercises for the pelvic floor can be done in a variety of situations, including sitting, standing, or lying down. For observable advancements in pelvic floor strength and general pelvic health, it is critical to perform these exercises consistently and on a regular basis. A healthcare provider or a pelvic floor physical therapist should be consulted if you have specific pelvic health issues or medical problems in order to receive individualized advice and recommendations for your exercise program. Undoubtedly, women need to perform pelvic floor exercises to keep their pelvic floor muscles strong and healthy. Exercises for these muscles can help prevent or treat problems including urine incontinence, pelvic organ prolapse, and poor pelvic health. These muscles support the bladder, uterus, and colon. Following are a few popular pelvic floor exercises for women. 1. Kegels. Place your legs slightly apart while you sit, stand, or lie down. Tense the pelvic floor muscles, as though you're trying to halt the flow of pee. After holding the contraction for 5 to 10 seconds, let go. Perform this procedure for 10-15 times, 3 to 4 times every day. 2. Bridge pose. Lie on your back with your legs hip-width apart and your knees bent. Raise your hips slowly off the ground while utilizing your glutes and pelvic floor muscles. After a little period in the bridge position, return your hips to their original position. Complete 3 sets of 10-15 repetitions each, followed by a short break. 3. Squats. Position your feet shoulder-width apart as you stand. While crouching down, maintain a straight back and an elevated chest. Squeeze the muscles in your pelvic floor as you stand back up. Complete 3 sets of 10-15 repetitions each, followed by a short break. 4. Flutter kicks. Lie on your back with your legs extended and your arms at your sides. Raise the bottoms of both legs a few inches. In a fluttering motion, alternate lifting each leg up and down. Perform this exercise for 30 to 1 minute, then pause. Do this a few times. 5. Deep breathing. Maintain proper posture while you sit or lie down comfortably. Breathe in deeply through your nose, allowing your belly and diaphragm to expand. Slowly and consciously exhale through your mouth. Perform this deep breathing exercise several times a day for a few minutes each time. To see improvements in pelvic floor strength and function, do these exercises frequently and consistently. Before beginning any workout program, it's always a good idea to speak with a healthcare provider or a pelvic floor physical therapist if you have any specific pelvic health issues or medical illnesses. Depending on your particular needs, they can offer recommendations and personalized advice.